for the authorities, and they're putting people's lives at risk.
Right. I want to put to you a comment from the head of the World Health Organization 2 days ago. We must all learn to control and manage this virus using the tools we have now. Lockdowns are not a long-term solution for any country. With that in mind, is elimination the right strategy for New Zealand?
I think elimination is the correct strategy for New Zealand and Australia. You have very few numbers. You got what I would call elimination, very, very close to probably zero. You might have had a few cases out there that were asymptomatic, but only a few. There's about 18, somewhere between 13 and 18% of cases will be asymptomatic, but not for a whole 102 days. And from a public health perspective, it's more cost effective as well. So if you can get over the sadness of the lockdown for the next few days or next few weeks until you get this under control, you can then go back to life as normal with the understanding, as Dr. Tedros will tell you, is to cooperate with those very, very easy public health requirements. Keep your distance, keep a mask on if you're in a crowded space, and test. Do a lot of testing.
All right. Professor Mary Louise McLaws from the University of New South Wales. Tēnā koe, thank you for your time this morning. Now, just so you know, we have been trying for some time on Q&A to have an interview with Dr. Ashley Bloomfield, the Director General of Health. We want to ask him some detailed questions about the border processes that have been in place and our strategy from this point forth. Once again this week, the Ministry of Health denied our request. From the beginning of this pandemic, Taiwan has led the way in controlling the spread of COVID-19 without having to lock down even once. So what can we learn from Taiwan? Here's reporter Fina Owen.
Taiwan, a team of 23.8 million, 486 total COVID cases, 7 deaths. Right now, around 29 currently infected and all looked after in hospital. What do you think we can learn from Taiwan's management of COVID? This is Bill Chen. He's Taiwan's representative in New Zealand.
In a sense, we learn from each other. You see the report here, the leaders here, the expert here, they notice that Taiwan is doing a good job. But for us, the same thing. New Zealand is doing a pretty decent job.
Taiwan was very quick off the mark, suspecting something was up in Wuhan late last year, and despite not even having observer status, advised the WHO of their concerns. They decided to follow their own course. They sent experts to Wuhan and screened all arrivals from there. Your experts went to Wuhan and came back and said this could be big.
Oh, not only you are right, totally right. So they arrived on 12 and they come back Taiwan on the 15, and on 16 we send out the first alert to the public.
Wellingtonian expat Ron Hansen was one of those who received the alert. He lives in Taichung City and works as a magazine editor. He was there when SARS hit Taiwan hard in 2003. He was expecting the worst when COVID hit.
So everyone was very, very tense, and we were kind of just waiting for it to hit. And then it was just kind of bizarre because it sort of started happening everywhere else except for Taiwan. It was just like dodging a hail of bullets.
The SARS experience had given Taiwan an advantage.
So out of the SARS, I think our government will restructure a lot of things in order to be prepared for any kind of pandemic.
So the epidemic infrastructure was already there, an agency set up called the Central Epidemic Command Centre. They've kept infection levels low without lockdown, schools open, workplaces humming, but temperatures checked and plenty of PEP.
We are lucky we don't experience lockdown. I think the face mask, to me personally, play a pretty probably important role that without a lockdown, we could still able, in a sense, to contain the virus as what we are today.
Face masks masks are issued to Taiwanese via their national health insurance cards. It's compulsory to wear them on public transport, but voluntary everywhere else. Most people wear them. Ron Hansen says he's frustrated that masks haven't been so readily promoted in New Zealand. He'd like to see Jacinda Ardern leading the way.
She's smart, so if she's wearing a mask, would come across as a smart thing to do. The culture needs to shift. I don't know, can some All Blacks wear some masks? There's plenty of celebrities in New Zealand. Could one of them step up? I want to see New Zealand learn from Taiwan, because there are obviously still some areas that need to be improved upon. And I think that the model is just sitting right here.
So apart from the mask wearing, what is the model? Ron Hansen has taken images of these measures in action.
Just getting a temperature check. I mean, I get my temperature checked 4 or 5 times a day, right? So it's just part of life. You know, if I go into a store, it's just like social distancing. It's just like we've just gone into a different gear. You know, the quarantine is obviously really, really important.
So arrivals into Taiwan are screened and their phones are set up for tracking. They go into quarantine at an approved facility or at home. A government official phones them twice a day. If they breach the quarantine, they can be fined up to $45,000.
When you consider how much damage can be done to a country when this virus gets out just from one person, to me it seems, heavy fines are justifiable.
And there are some breaches.
Certainly the society is never perfect. There are always something happen. I mean, the trust is the key word. I think people in between us, I need to trust the people around me, my colleague, in fighting this disease. And people, in general term, have to trust the system, or trust the government, or trust the expert. I think without this, everybody's pointing finger at everybody.
Legislation has allowed Taiwan to employ digital tracking and big data via personal cell phones and health cards. Taiwan hasn't tested for COVID as extensively as New Zealand. Ron insists that's due to its emphasis on prevention and a world-renowned health system where a visit to the doctor is $10.
The thing is that Taiwan is not part of the WHO, right? It did sort of bring people together. We're kind of these outsiders.
Bill Chen isn't keen to discuss the WHO. Taiwan, he says, is focusing on sharing vital health information with the world and PPE supplies with countries that need them. So you don't think it should be politicized because it's about human health?
No. The government, not only here in New Zealand, back home in Taiwan, around the globe, every government, what can they do? They do the best to contain this disease, to protect people's health, the well-being, and this is the priority. What else?
Fiona Owen with that report. If you're wondering why Taiwan isn't a member of the World Health Organization, it's because of its complex relationship with China. China sees Taiwan as a breakaway province, while Taiwan sees itself as an independent state, even though it isn't afforded that status by some world bodies, including the World Health Organization and the United Nations. I will ask National's health spokesperson, Dr. Shane Reti, what National would